Angioblastoma, plural, angioblastomas, angioblastomata, Greek angion vessel blastos germoma, a tumor of blood vessels in the brain. Kinds of angioblastomas are angioblastic, meningioma, and cerebral angioblastoma. Angiocardiogram, a series of radiographic images of the heart taken in rapid succession during the immediately after injection of a radiopaque contrast medium into coronary blood vessels. Angiocardiography, Greek angion plus cardia, heart, graphene to record. The process of producing a radiograph of the heart and great vessels of the heart. A radiopaque contrast medium is injected directly into the heart by a catheter introduced through the antecubital veins. X-ray films are taken as the contrast medium passes through the heart and great vessels. See also angiography. Angiocardiopathy, Greek angion vessel cardia, heart, pathos, disease, a disease of the blood vessels of the heart. Angiocarditis, an inflammation of the heart and large blood vessels. Angiocatheter, a hollow, flexible tube inserted into a blood vessel to withdraw or instill fluids. Angiochondroma, angiochondromas, angiochondromata, Greek angion plus chondros, cartilage, oma, a cartilaginous tumor characterized by an excessive formation of blood vessels. Angioedema, an acute painless dermal subcutaneous or submucosal swelling of short duration. It involves the face, neck, lips, larynx, hands, feet, genitalia, or viscera. It may result from food or drug allergy, infection, or emotional stress, or it may be hereditary. Treatment depends on the cause. For severe forms, subcutaneous injections of epinephrine, intubation, or tracheotomy may be necessary to prevent respiratory obstruction. Prevention depends on the identification and avoidance of causative factors, also called angioneurotic edema. See also anaphylaxis, serum sickness, urticaria. Angioendothelioma. See hemangioendothelioma. Angiofibroma, plural, angiofibromas, angiofibromata, Greek angion plus Latin fiber, Greek oma, an angioma containing fibrous tissue, also called fibroangioma, telangiectatic fibroma. Angiogenesis, Greek angion plus genesis or origin, the ability to evoke blood vessel formation, a common property of malignant tissue. The presence of angiogenesis in breast tissue is regarded as a precursor of histologic evidence of breast cancer. Angiogenin, a protein that mediates the formation of blood vessels, a single-chain basic protein cloned from molecules of the tumor angiogenesis factor TAF and human colon cancer and human colon cancer cells. Angiogenin is used experimentally to stimulate the development of new blood vessels in wound healing, stroke, or coronary heart disease. See also tumor angiogenesis factor, angioglioma, angiogliomas, angiogliomata, Greek angion plus glia, gluoma, a highly vascular tumor composed of neuroglia, angiogram, Greek angion, vessel gramma, writing, a radiographic image of a blood vessel into which contrast medium has been injected, also called anterior, anteriogram. Angiograph, Greek angion, vessel graphene, to record, an instrument that records the patterns of pulse waves. See also sphygmograph. Angiography, Greek angion plus graphene, to record. The X-ray visualization of the internal anatomy of the heart and blood vessels after the intravascular introduction of radiopaque contrast medium. The procedure is used as diagnostic aid in myocardial infarction, vascular occlusion, calcified atherosclerotic plaques, cerebrovascular accident, portal hypertension, renal neoplasms, renal artery stenosis as a causative factor in hypertension, pulmonary emboli, and congenital and acquired lesions of pulmonary vessels. The contrast medium may be injected into an artery or vein, or introduced into a catheter inserted in a peripheral artery and threaded through the vessel to visceral site. Because the iodine in the contrast medium may cause a marked allergic reaction in some patients, testing for hypersensitivity is indicated before the radiopaque substance is used. After the procedure, the patient is monitored for signs of bleeding at the puncture site in the bed, and bed rest for a number of hours is indicated. Angiographic adjective. Angiohemophilia. See von Willebrand's disease. Angiokeratoma, plural angiokeratomas, angiokeratomata, Greek angion plus keras, horn, oma, a vascular horny neoplasm on the skin characterized by clumps of dilated blood vessels, clusters of warts, and thickening of the epidermis, especially the scrotum and the dorsal aspect of the fingers and toes. Angiokeratoma, circumscriptum, a rare disease, a rare skin disorder characterized by discrete papules and nodules in small patches on the legs or on the trunk. Angiokeratoma corporis diffusum, an uncommon familial disease in which phospholipids are stored in many parts of the body, especially the blood vessels, causing vasomotor, urinary, and cutaneous disorders, and in some cases muscular abnormalities. Characteristic signs of the disease are edema, hypertension, and cardiomegaly, especially enlargement of the left ventricle, diffuse nodularity of the skin, albumin, erythrocytes, leukocytes, and casts in the urine and vacuoles and muscle bundles, also called Fabry's disease. Angiokeratoma, see angiokeratoma, angiolipoma, plural angiolipomas, angiolipomata, Greek angion plus liposfat oma, a benign neoplasm containing blood vessels and tissue, also called lipoma cavernosum, telangiectatic lipoma, angioma, plural angiomas, angiomata, Greek angion vessel oma, tumor, any benign tumor with blood vessels, hemangioma or lymph vessels, lymphangioma. Most angiomas are congenital. Some, such as cavernous hemangiomas, may disappear spontaneously. Angioma, suffix meaning a tumor composed chiefly of blood and lymph vessels, fibroangioma, glomeangioma, angioma arterial racemosin, Greek angion plus oma, Latin arteria, air pipe, racemus, grape, a vascular neoplasm characterized by the intertwining of very many small, newly formed, dilated blood vessels. Normal blood vessels become affected. Angioma cavernosum. See cavernous hemangioma. Angioma cutis, a nevus composed of a network of dilated blood vessels. Angioma, plural, angiomas, angiomata, Greek, angion, vessel, oma, tumor, any benign tumor with blood vessels. Hemangioma, or lymph vessels, lymphangioma. Most angiomas are congenital. Some, such as cavernous hemangiomas, may disappear spontaneously. Angioma, suffix meaning a tumor, composed chiefly of blood and lymph vessels. Fibroangioma, glomeangioma. Angioma arterial racemosin, emosem. Greek angion plus oma plus Latin arteria, air pipe, racemus, grape. A vascular neoplasm characterized by the intertwining of many small, newly formed dilated blood vessels. Normal blood vessels become affected. Angioma cavernosum. See cavernous hemangioma. Angioma cutis, a nevus composed of a network of dilated blood vessels. Angioma lymphaticum. See lymphangioma. Angioma serpiginosum. Greek angion plus oma plus Latin serpere, to creep. A cutaneous disease characterized by rings of tiny vascular points appearing as red dots. Angiomatosis, a condition characterized by numerous vascular tumors. Angiomyoma, plural, angiomyomas. Angiomyomata, Greek angion plus mice muscle oma, a tumor composed of vascular and muscular tissue elements. Angiomyoneuroma, see glomeangioma. Angiomyosarcoma, plural, angiomyosarcomas. Angiomyosarcomata, Greek angion plus mice, muscle, sarx, flesh, oma, a tumor containing vascular, muscular, and connective tissue elements. Angioneuroma, see glomangioma. Angioneurotic anuria, anuria. Greek angion plus neuron nerve, a plus oron, not urine, an abnormal condition characterized by an almost complete absence of urination caused by destruction of tissue in the renal cortex. Angioneurotic edema, see angioedema. Angioneurotic gangrene, Greek angion plus neuron nerve, gangrena, the death and putrefaction of tissue caused by an interruption of the blood supply resulting from thrombotic arteries or veins. Angioneurotic oedema, see angioedema. Angiopathy, Greek angion, vessel, pathos, disease, a disease of the blood vessels. Angioplasty, Greek angion, vessels, plastine, to mold, the reconstruction of blood vessels damaged by disease or injury. Angiopoiesis, Greek angion vessel poiein, to make, the process of blood vessel formation. Angiography, Greek angion vessel raphy, suture, the repair by suture of any blood vessel. Angiosarcoma, a rare malignant tumor consisting of endothelial and fibroblastic tissue that proliferates and eventually surrounds vascular channels. The condition usually occurs in older persons. Angiosarcoma has been associated with exposure to vinyl chloride and arsenic, also called hemangiosarcoma, malignant hemangiendothelioma. Compare angioma. Angiosclerosis, Greek angion vessel sclerosis, hard osis, hard osis condition, a thickening and hardening of the wall of the blood vessels. See atherosclerosis. Angioscope, a type of microscope that permits inspection of the capillary vessels. Angiospasm, a sudden transient constriction of a blood vessel, also called vasospasm. See also vasoconstriction. Angiotensin, Greek angion, Latin tender, to stretch, a polypeptide in the blood that causes vasoconstriction, increased blood pressure, and the release of aldosterone from the adrenal cortex. Angiotensin is formed by the action of renin on angiotensinogen, an alpha-2 globulin that is produced in the liver and constantly circulates in the blood. Renin stimulated by juxtaglomerular cells in the kidney in response to decreased blood volume and serum sodium, acts as an enzyme in the conversion of angiotensinogen to angiotensin 1, which is rapidly hydrolyzed to form the active compound angiotensin 2. The vasoconstrictive action of angiotensin 2 decreases the glomerular filtration rate, and the concomitant action of aldosterone promotes sodium retention, with the result that blood volume and sodium reabsorption increase. Plasma angiotensin increases during the luteal phase of the menstrual cycle and is probably responsible for an elevated level of aldosterone during that period. Angiotensin is inactive by peptidases, also called angiotensinases, in plasma and tissues. Angiotensin converting enzyme ACE, a protein dipeptidyl carboxypeptidase that catalyzes the conversion of angiotensin 1 to angiotensin 2 by splitting two terminal amino acids. ACE inhibiting agents are used in hypertension control. Angiotensin converting enzyme ACE, a protein dipeptidyl carboxypeptidase that catalyzes the conversion of angiotensin 1 to angiotensin 2 by splitting two terminal amino acids. ACE inhibiting agents are used in hypertension control. Angiotensin converting enzyme ACE inhibitor. Serum protease inhibitor that blocks the formation of angiotensin II and decreases the degradation of bradykinin and other kinins. ACE inhibitors cause a decrease in sodium and water retention, a decrease in blood pressure, an improvement in cardiac output, and a decrease in heart size. Angiotensinogen, a serum globulin produced in the liver that is the precursor of angiotensin. Angiotensin sensitivity test, AST, a test for sensitivity to angiotensin II by infusion of angiotensin II amide into the right cubital vein. Angiotensin is metered in doses that increase by 1 ng/kg minute at 5-minute intervals. A positive AST result is an effective pressor dose or one that causes a 20 millimeter Hg rise in diastolic blood pressure at an infusion rate of less than 10 ng/kg a minute. Angle, Latin angulus, 1. The space of the shape formed at the intersection of two lines, planes, or borders. The divergence of the lines, planes, or borders may be measured in degrees of a circle. 2. In anatomy and physiology, the geometric relationships between the surface of body structures and the positions affected by movement. Angle board, in dentistry, a device used for facilitating the establishment of reproducible angular relationships between a patient's head, the X-ray beam, and the X-ray film. Angle closure, glaucoma, see glaucoma. Angle former, in dentistry, one of a series of paired cutting instruments having cutting edges at an angle other than a right angle in relation to the axis of the blade, also called bayonet angle former. Angle of convergence, an angle formed between the visual axis of an eye focused on an object and a median line. Angle of incidence, the angle at which an ultrasound beam hits the interface between two different types of tissues, such as the facing surfaces of bone and muscle. The angle is also affected by the difference in acoustic impedance of the different tissues. Angle of iris, the angle formed between the cornea and the iris at the periphery of the anterior chamber of the eye. The aqueous fluid normally drains through this angle, which may be blocked in glaucoma, also called filtration angle. Angle of Lewis, Pierre C. A. Lewis, French physician, 1787 to 1872. The sternal angle between the manubrium and the body of the sternum. Angle of mandible, the measure in degrees of the relationship between the body and the ramus of the mandible, used in cephalometric measurements of skull radiographs, also called the gonial angle. Angle of refraction, Latin angulus plus refringere, to break apart. The angle that a refracted ray of light makes with a line perpendicular to the refracting surface at the point of refraction, also called refracting angle. Angle of Treats, Wenzel Treats, Sazak physician, 1819 through 1872. A sharp curve or flexure at the junction of the duodenum and jejunum. Angel's classification of malocclusion, Edward Hartley Angle, American orthodontist, 1855 to 1930, 75 years old. A classification of the various types of malocclusion. The system has been modified and includes three main classes of occlusions, each class having several types or divisions. Classifications is based on the relation of different teeth in the upper and lower jaws, such as the maxillary and the mandibular, first molars, and the incisors. See also classifications of malocclusion. Angor, a condition of extreme distress, usually occurring in abdominal or pectoral angina or during a sudden attack of blindness. Engström. Anders J. Engström, Swedish physicist, 1814 through 1871. A unit of measure of length equal to 0.1 millimicron, 1/10,000,000th of a meter, or 10 to the minus 10 square root, meter, also called angstrom unit, AU. Angular gyrus, Latin angulus plus Greek gyros, a folding convolution in the inferior parietal lobe where it unites with the temporal lobe of the cerebral cortex. Angular movement, Latin angularis, sharply bent, one of the four basic movements allowed by the various joints of the skeleton. It is a movement in which the angle between two adjoining bones is decreased as in flexion or increased as in extension. Compare circumduction, gliding, rotation, angular spinal curvature, angular spinal curvature, Latin angulus, plus spina, backbone, curvature, bend, a sharp bending or sloping of the vertebral column. See also gibbous. Angular stomatitis, inflammation at the corner of the mouth. Angular vein, one of a pair of veins of the face formed by the junction of the frontal and supraorbital veins. At the root of the nose, each angular vein receives the flow of venous blood from the infraorbital and superior palpebral, the inferior palpebral, and the external nasal veins, becoming the first part of one of the two facial veins. Angular stomitis, inflammation at the corner of the mouth. Angular vein, one of a pair of veins of the face formed by the junction of the frontal and the supraorbital veins. At the root of the nose, each angular vein receives the flow of venous blood from the infraorbital and superior palpebral and inferior palpebral and the external nasal veins, becoming the first part of one of the two facial veins. Angulated fracture, a fracture in which the fragments of bone are at angles. Angulation, Latin angulatus, bent. 1. An angular shape or formation. 2. The discipline of precisely measuring angles, as in mechanical drafting and surveying. 3. In radiography, the direction of the primary beam of radiation in relation to the object being radiographed and the film used to record its image. See also horizontal angulation, vertical angulation. Anhedonia, Greek a plus hedon, not pleasure. The inability to feel pleasure or happiness in response to experiences that are ordinarily pleasurable. It is often a characteristic of major depression. Anhedonic, adjective. Anhidrosis, Greek a plus hydros. Anhidrosis, Greek a plus hydros, without sweat. An abnormal condition characterized by inadequate perspiration. Anhidrotic, anhidrosis, anhidrotic. 1. Pertaining to Anhydrosis. 2. An agent that reduces or suppresses sweating. Anhydrase. Greek A, not hydor, water. An enzyme that catalyzes the elimination of water molecules for certain compounds, as carbonic anhydrase dehydrates carbonic acid, thereby controlling the amount of carbon dioxide in the blood and lungs. Anhydration, see dehydration. Anhydride, Greek A plus hydor, without water. A chemical compound, especially an acid, derived by the removal of water from a substance. Anhydrosis, or anhydrose, Greek A, without hydor, water, and absence of water. Anecteric, Greek A plus icterus, not jaundice, pertaining to the absence of jaundice. Anecteric hepatitis, a mild form of hepatitis in which there is no jaundice. Icterus. Symptoms include anorexia, gastrointestinal disturbances, and slight fever. Aspartate aminotransferase and alanine aminotransferases are elevated. The infection may be mistaken for flu or be undetected. Compare hepatitis. See also jaundice. Anidine, Greek A plus eidos, not form. Formless, shapeless, denoting an undifferentiated mass such as an anidase. Also anidian, anidos, anidius, an anomalous rudimentary embryo consisting of a simple rounded mass with little indication of the body parts. A kind of anidus is embryonic anidus, also called fetus anidus. Anidian, anidos, see anidian. Aniline, Arabic, alnil, indigo, an oily, colorless, poisonous liquid with a strong odor and burning taste, formerly extracted from the indigo plant and now made synthetically by using nitrobenzene in the manufacture of aniline dyes. Industrial workers exposed to aniline are at risk for developing methemoglobinemia and bone marrow depression, also called aminobenzene. Analingus, sexual stimulation of the anus by the tongue or lips. Analingus, sexual stimulation of the anus by the tongue or lips. Analingus. Aniline parasulfonic acid, see sulfanic acid. Analysm, Arabic, alnil, indigo, Greek, ismos, state. A condition of poisoning resulting from the exposure to aniline compound. Symptoms generally include cyanosis, weakness, cold sweats, irregular pulse, breathing difficulty, coma, convulsions, and possible sudden heart failure. Treatment includes gastric lavage and induction of emesis, also called anilinism. See also aniline. Anima, Latin soul. 1. The soul or life. 2. The active ingredient in a drug. 3. The Jungian psychology. A person's true inner unconscious being or personality as distinguished from overt personality or persona. In analytic psychology, the female component of the male personality. Compare animus. Animal, a living organism capable of movement that subsists on the breakdown of organic substances to a usable form, followed by synthesis of essential nutrient organic compounds. The distinction between plants and some lower animals is ambiguous. Animal-assisted therapy, a nursing interventions classification is defined as purposeful use of animals to provide affection, attention, diversion, and relaxation. See also nursing interventions classifications. Animal pole, Latin anima, the active formative part of the ovum protoplasm that contains the nucleus and bulk of the cytoplasm, and where the polar bodies form. In mammals, it is also the site where the inner cell mass develops and gives rise to germ layers such as the ectoderm, also called germinal pole, compare vegetal pole. Animal starch, see glycogen. Animation, one, a state of being alive, two, an ability to put into action a vivid appearance of life. Animus, Latin spirit, one, the active irrational soul, the animating principle of life. Two, an analytic psychology, the male component of the female personality. Three, in psychiatry, a deep-seated antagonism that is usually controlled but may erupt with virulence under stress. Compare anima. Anion, Greek ana plus ion, backward going. Anion, one, a negatively charged ion that is attracted to the positive electrode, anode in electrolysis. Two, a negatively charged atom, molecular radical complication. Anion exchange resin, any one of the simple organic polymers with high molecular weights that exchange anions with other ions in solution. Anion exchange resins are used as antacids in treating ulcers. Compare cation exchange resin. Anion gap, the difference between the concentrations of serum cations and anions determined by measuring the concentrations of sodium cations and chloride and bicarbonate anions. It is helpful in the diagnosis and treatment of acidosis, and it is estimated by subtracting the sum of sodium and bicarbonate concentrations in the plasma from that of sodium. It is normally about 8 to 14 MEq/L and represents the negative charges contributed to plasma by unmeasured ions or ions, other than those of chloride and bicarbonate, mainly phosphate, sulfate, organic acids, and plasma proteins. Anions other than chloride and bicarbonate normally constitute about 12 MEq/L of the total anion concentration in plasma. Acidosis can develop with or without an associated anion increase. An increase in the anion gap often suggests diabetic ketoacidosis, drug poisoning, renal failure, or lactic acidosis, and usually warrants further laboratory tests. Anionic, Greek ana, not ion going, pertaining to an anion. Anise, the anise, the fruit of the Pimpinella anisum plant. Extract of anise is used in the preparation of carminatives and expectorants. Anise echinacea, anise iconia, Greek anisos, unequal icon image, and a normal and abnormal ocular condition in which each eye perceives the same image as being of a different form and size. Anismus, extreme contraction of the external sphincter of the anus. Anismus. Aniso, prefix meaning unequal, asymmetric, or dissimilar. Anisiconia, anisognathos, anisocoria, Greek anisos, unequal core pupil, and an inequality of the diameter of the pupils of the two eyes. anisocytosis, anisocytosis, Greek anisos plus chitos cell, an abnormal condition of the blood characterized by excessive red blood cells of variable and abnormal size. Compare poikilocytosis, see also macrocytosis, microcytosis, anisogamete, Greek anisos plus gamos, marriage, a gamete that differs considerably in size and structure from the one with which it unites as the macrogamete, the microgamete of certain sporozoa. Compare heterogamete, isogamete, anisogamatic adjective.